you're walking in the forest and you get bit by an animal. Your brain's going to know that you got bit by something, and it's going to send this pain signal, and you're going to experience pain. The next time you're walking in the forest, you hit a branch. Well, your brain senses that stimuli, and it's going to tell you that you got bit by something, even though you might not have, because it remembers that factor and those experiences. Most people's chronic pain tends to come from some sort of pain science or neuroscience within the brain, whereas an acute injury will be tissue damage. So someone comes to me in, a week after they went to lift something and they felt a pop in their back or felt something in their back. That's an acute injury, probably some tissue damage along with that. But if someone comes to me 5-6 months down the line saying my back's been hurting me for this however long, typically your tissues will heal naturally over time. So typically that's not tissue damage. There's something else going on. Most people with low back pain, it's unspecified, meaning there's no real true injury. It's your back is weak. And so your brain tells you there's going to be damage. Don't do this. And that will be after maybe 1 or 2 attempts. At some point, it's kind of like the straw that broke the camel's back. It's not just one episode. It's your brain understanding that bending over multiple times over a course of a period, that your back isn't strong enough to do this. So let's avoid it, because at some point there will be an injury to yourself. And in that case, you avoid doing that and you continue to get weaker. Your back continues to get weaker. There's a large percentage of people that have different pathologies of their back but are not painful. So a study came out showing of 1,100 people were MRI'd that did not have low back symptoms, and they did statistics based on certain categories of pathology, diagnosis, so disc herniations and problems with the joints itself. And one that sticks out is 60% of people the age of 25 to 35 had disc herniation problems in their back, but they were asymptomatic. Disc herniated. So the disc is out of place, not in the right place, is popping out a little bit, which we assume would usually cause pain. But now we're finding out that these pathologies, these injuries, aren't actually the prime contributor to maybe low back pain. It's that your back is weak, or other factors such as disuse, you avoiding certain movements and stuff like that. So one thing that we do is something called graded exposure or graded exercise, which is doing that motion that you think is fearful in a smaller amount or a lesser weight of objects, and that will then make your brain and you understand that this is not painful and that you can do this. And eventually you start getting improved strength, which actually decreases pain throughout that movement. So one graded exposure, graded exercise would be if someone with, again, going back to the back pain, right? Doing twisting, rotating. A lot of people believe that rotating or twisting is bad for your back, and people with low back pain will attribute rotating or bending and rotating as a painful experience. So now if I can have them just slowly rotate to their pain level, right to where before they get pain, multiple times a day throughout the week, they will notice by the end of the week that they've gone a little further each time, because you're getting this remapping in your brain of, okay, this is not a painful movement. I'm not going to cause tissue damage doing this movement. So that's graded exposure. I would say either an injury to the ankle or an injury to the knee. We see that a ton in that someone who tears their ACL, the ligament, the big ligament in their knee, even though we can see that it's repaired and we have the leg strong and it's back to normal and we have them running and everything, they will have this fear of re-tearing it and having that experience of, this is what it felt like when I tore it. This is all what I had to go through after I tore it. I don't ever want to do that again. And so they'll become very hesitant with certain movements. I had an athlete before the Army that had it, and he didn't want to do box jumps. He didn't want to do low box jumps because he was afraid that when he landed, he would re-tear his ACL. And that's just not true. If the leg is strong enough and down the line, when you start doing box jumps with ACL tears, the graft and the repair is healed enough that it is strong enough to take it. If the muscles are strong, you should be able to do that movement and have no issues. And it was just getting him to understand, okay, I need to do this. And so again, going back to graded exposure, I started him with a very low box, had him do it a little bit, then had him do it with a single leg, and then built up the box to let him understand that you're strong enough to do this and your knee's not going to buckle or give out on you.